New at midday, coronavirus antibody tests are still being bombarded with questions about their accuracy and reliability. More and more tests are being rushed to the market, but 13 Chief Investigator Darcy Spears shows us they still don't come with guarantees.
Direct-to-consumer marketing campaigns are on the rise as companies court customers who are eager for answers as to whether they had COVID-19. But buyer beware. We've learned the currently available tests may be premature, even a money grab by commercial labs. Yumi Yamamoto's older son sits in a LabCorp medical office after a blood draw to test for COVID-19 antibodies. The reason? His younger brother.
My son was sick early in February.
Masked up, arm out, her youngest gets ready for his own test.
Well, I figured the more information that we have, the better it is.
Her family is not alone.
I'm convinced
that we had it.
Yeah.
Brian and Monica Ursua believe they had coronavirus in January after Brian, a convention teamster, built the Samsung booth at CES. You guys are pretty well convinced that you're survivors.
Yes.
Oh, yeah.
Yes, I would like to get tested for the antibodies.
Enter companies like LabCorp. It's been sending out these marketing emails to anyone who's used its services in the past, saying testing is an important part of health and safety, and we want to make it as easy as possible for you to get critical information.
There's no harm in knowing if we've already had it.
The harm can come in how consumers use the information.
Yeah, my recommendation is to not put too much faith in the antibody tests at all at this point. So,
Dr. Terry Lehman is Chief Medical Officer at Our Health.
So everybody's hoping that the antibody testing will be kind of a holy grail to get back to normal operations and normal day-to-day activities. It should not be used for that at this point.
Dr. Lehman says tests have been allowed to come to market without much data behind them. FDA approval typically requires multiple validation steps with robust data, but coronavirus antibody tests have been rushed under emergency use authorizations, which allow the companies who develop the tests to validate their own data.
Usually that's limited to 60, 70, 80 patients, where we're normally getting labs validated with 80,000 patients.
He's skeptical about test results, pointing to what consumers may not see. LabCorp's website runs deep with disclaimers, warning there is not enough evidence at this time to suggest that people who have antibodies are protected against future infections from the virus.
So even in the future, if we determine what level of antibodies are appropriate to give long-term immunity, the testing that's available currently won't give us those answers.
LabCorp's website continues. Results from this test also will not provide information on whether you can spread the virus to others and is not used as a basis for diagnosis.
If that is positive, it does not mean that you're safe to go back into an infectious environment or a workplace without restrictions. It does not mean that you may not pass it on to others. It does not mean you're out of the woods by any stretch of the imagination.
And then there's a chance the results are just wrong.
You know, your test may be positive because you got exposed to a different coronavirus in the past.
Including, he says, the one that causes the common cold. LabCorp's website confirms the possibility of a false positive, adding negative results do not rule out COVID-19 infection, so follow-up testing with a molecular diagnostic should be considered for some individuals.
You feel like you're almost driving in a fog. It's a fog of information that you don't know what's going to hold true or not.
Despite Yumi being sure her younger son had COVID-19 after a trip to California earlier this year, the family all tested negative.
I was hoping that maybe we'd find out there'd be some immunity to it. And in true reality, that's all I really was hoping for. And it almost felt like wanting a golden ticket from Willy Wonka.
Yumi says had her family tested positive,
I would probably be a little bit more lax, to be honest with you. I think that even though I don't know, maybe it might provide a false sense of security.
For that reason,
I'm not recommending that patients get these tests in general. The one exception is when patients are trying to sign up to be a convalescent plasma donor.
As we've reported, convalescent plasma donations from recovered COVID-19 patients could be used to help treat the critically ill. Dr. Lehman says antibody tests are also good from a public health standpoint to understand the prevalence of the disease in a given population. From a consumer standpoint,
There's just a whole bunch of too much information and not enough.
LabCorp would not provide an on-camera interview, instead sending a statement which says in part, the serological antibody tests offered by LabCorp are very accurate, are being offered pursuant to emergency use authorizations issued by the FDA, and have been extensively validated by LabCorp. Just last week, they started offering a new test, which they say has a 99.8% specificity. UMC is preparing to start antibody testing May 30th. Doctors here wouldn't go on camera either, saying they want to wait until all the details are finalized before moving forward with an interview. Darcy Spears, 13 Investigates.